Well, one of the things that I think is great about FamilyWise, especially here, is that we do a lot of proactive treatment. A lot of times you go into a doctor, you have elevated cholesterol, you're a little overweight, kind of have these symptoms that, we'll just wait and see. Here we don't really like to sit on it as much. If you're coming to me at 25, you're overweight, your cholesterol's up, your blood pressure's up, all of these things, I'm going to look at you and say, let's fix it now. We also have advanced testing to let you know, you may be just a little overweight, cholesterol's borderline, but do you have a family history that we can check, advanced testing to see, is your risk higher than the person sitting next to you based on your parents' genes? And we do those things to try and help people know ahead of time before they get to the disease, we've already stopped it in its path. That's really our role, is trying to educate the population, to teach them what choices they are making, what choices they could be making, and how this all plays out in not just a very, here and now moment, but what are we looking at 5, 10, 15 years from now? How are the choices we make now going to affect you in 15 years? Diabetes is not always understood. They think, oh, I just have high blood sugar. What is that going to do? Well, it actually does a lot of things. It damages your kidneys. It damages your blood vessels. It damages your vision. Changes, you hear about people getting amputations. These are people that have chronic nerve disabilities in their legs. And what's scary is that most of these people with type 2 diabetes were adults. These adults were developing symptoms 20 years into their disease, right? So now we have 10-year-olds that are developing type 2 diabetes. One of the biggest killers in America right now is heart disease. Well, that comes a lot from the diet as well. Treatment of obesity, there's a couple different things we have to look at. Here at FamilyWise, we don't just focus on lifestyle changes, although that's the hugest thing that you could ever do to really treat this disease. Lifestyle is the number one, first and foremost thing that has to be addressed. Increasing your activity and decreasing your intake of calories. Those are the two crucial elements. Medications that actually can help decrease your appetite. They're called appetite suppressants that we can use. There's also some medications that decrease your absorption of some of these calories and fat. And that's a lot more popular now, something called lap band, where patients can go in and basically a portion of their stomach is kind of just shrunken into a little kind of tube, I guess you could call it, where basically they're limited on the amount of food they can eat, but that lap band can be removed at some point. So once they've changed their lifestyle, they've lost the weight with the assistance of the lap band, then they can actually have it removed if they need to, and there's no long-term effects from that. I like to educate our patients and let them know that they're not alone. It doesn't make them a bad person because they're overweight, but teaching them that there are ways to change it. They've shown lifespan is actually decreased 6 to 7 years in patients that are overweight and obese versus the normal person. This is a huge impact on families. People feel a little bit of self-confidence when they feel like they've accomplished that weight loss. They feel more esteem in their presence. But also, if you're taking medications for blood pressure or cholesterol, losing that weight may mean you don't have to take those medications anymore. On our website, FamilyWiseHealth.com, just set up an appointment and just make a note to whoever schedules the appointment that you'd like to come in and just discuss, weight management.